Hello, everyone, and welcome. I'm excited to be here today to talk about a powerful topic, not to replace you, but to make you significantly better. How to use AI as a doctor. In this presentation, we'll explore how artificial intelligence can enhance your abilities, improve patient care, and support your decision-making. We'll cover practical ways to integrate AI into your daily practice, all while emphasizing that it's here to assist, not replace. So, let's dive in and see how AI can become a valuable tool in your medical toolkit. The quality of AI's output really depends on how precise and well-structured the clinician's input is. It's not just about asking a simple question. It's about moving beyond basic keyword searches and engaging in structured clinical reasoning. AI performs best when it's given structured clinical data and asked clear, specific questions. For example, vague questions like, "Patient with abdominal pain, what should I do?" tend to generate equally vague and unhelpful answers. If we treat AI like a search engine and just throw in broad, vague queries, we end up with vague and often unhelpful clinical guidance. That's why it's so important to avoid the search engine trap. Instead, we should focus on crafting specific, well-structured questions to unlock the full potential of AI and get more meaningful, actionable insights. This ties into our overall theme. Effective AI use depends on how we communicate with it. Structured input allows AI to focus its analysis effectively, which leads to more accurate and relevant insights. When we provide well-organized data, AI can better identify patterns and evidence that are specific to the case at hand. It's important to understand that AI analyzes these patterns, evidence, and guidelines based on the specific data we give it. As clinicians, our role remains crucial. We gather the patient's history, perform physical exams, and collect laboratory and imaging results. These are the building blocks that make the AI's analysis meaningful. For AI to be most effective, we need to supply relevant findings, ensure the clinical timeline is accurate, and ask clear, focused questions. This helps AI process the information efficiently. Think of AI as a clinical consultant. It processes structured data without jumping to unfounded assumptions. It's not replacing us, but enhancing our decision-making with precise, data-driven insights. In summary, structured data is essential because it allows AI to serve as a reliable, supportive clinical partner, helping us deliver better patient care. Now, let's look at how our system provides treatment options that are firmly backed by supporting evidence and medical literature. This ensures that the recommendations are not just based on intuition, but are grounded in the latest and most reliable research. The engine also plays a crucial role in generating differential diagnoses, which are essentially the possible conditions that could explain a patient's symptoms. It then ranks these options by their probability, helping clinicians focus on the most likely causes first. Based on this, it suggests the next steps to take, guiding decision-making in a logical, step-by-step manner. This process is quite sophisticated. It starts by identifying key symptoms, then extracts relevant risk factors, and compares patterns across different cases. The AI systematically processes published protocols, clinical guidelines, and thousands of diagnostic pathways. By analyzing all this vast medical knowledge and literature, the AI can generate evidence-based diagnostic pathways that are tailored to each patient. This brings us to the core of the AI reasoning engine, a systematic analysis of medical knowledge that helps clinicians make more informed, accurate decisions. It's about transforming complex data into clear, actionable insights that improve patient care. Let's talk about how AI identifies patterns in clinical data. The key here is that AI's ability to recognize meaningful patterns really depends on the level of detail in the clinical snapshot we provide. Essentially, the more precise and comprehensive the data, the better AI can analyze and generate accurate insights. This is why it's crucial for clinicians to prioritize accuracy and completeness when entering data. Good, well-structured data acts like a solid foundation. It enables AI to deliver powerful and reliable insights that can truly support clinical decision-making. On the flip side, if the data input is poor or incomplete, the AI's reasoning will be compromised. It might lead us down the wrong path or produce misleading conclusions. So, the quality of the data we feed into AI directly influences its ability to reason effectively. In fact, the potential of AI's clinical reasoning is fundamentally limited or empowered by the input data quality. The better the data, the stronger and more trustworthy the AI's reasoning. So, to sum up, data quality directly determines AI's reasoning power, and understanding this connection is essential as we integrate AI into clinical practice. When approaching a complex clinical case, adopting a structured method is essential. This approach enables AI to analyze the case with maximum precision and relevance, ensuring we don't overlook critical details. Incorporating laboratory results and imaging findings helps paint a complete picture of the patient's condition. It's also important to include pertinent positives and negatives from both the history and physical exam. These details often guide us toward the right diagnosis. Gathering vital signs, understanding when symptoms began, and establishing a clear timeline of the presentation give us context and help track progression. Overall, creating a comprehensive clinical snapshot, covering vitals, timeline, and findings, is the foundational step for effective AI-assisted analysis. This structured snapshot ensures that we have all the key pieces in place to make informed decisions and optimize patient care. Let's talk about structured prompting and why it's so essential when working with AI in a clinical setting. Essentially, it helps us ensure that the AI's output is tailored specifically to the clinical need at hand. For example, if we need evidence-based recommendations, it's important to ask for site references like PubMed, ACS, or SAGES to verify the information. This step keeps the recommendations grounded in reliable sources. Another key point is clearly specifying the desired outcome. Whether you're looking for a differential diagnosis, a workup plan, or management options, stating this explicitly guides the AI to provide relevant and focused responses. It's also crucial to define the AI's role, like asking it to act as a general surgeon, which sets the context for its analysis. This helps the AI adopt the appropriate perspective and depth of knowledge. Overall, effective AI utilization hinges on precise prompting. This means clearly defining both the AI's role and the specific clinical outcome you're aiming for. Mastering this art of prompting is fundamental to extracting useful, accurate, and actionable information from AI in our practice. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's start by understanding the significance of structured data input. It allows AI to analyze patient information effectively while maintaining patient privacy and complying with HIPAA regulations. This is crucial because it ensures we can leverage AI insights without risking sensitive data exposure. Moving on to the physical examination, the patient presents with a firm, non-mobile, non-tender mass in the right lower quadrant. This finding suggests a palpable abnormality that warrants further investigation. In terms of medical history, this patient has not had previous colonoscopies or abdominal surgeries, which can sometimes complicate diagnoses. He also has hypertension and hyperlipidemia, but is a non-smoker, which helps us understand his overall risk profile. Looking at the clinical history, there's a significant weight loss of about 30 pounds over recent months, which is concerning. Combined with his symptoms of right lower quadrant pain, constipation, and blood in the stool, these signs point toward a serious underlying condition that needs prompt attention. Now, why is this case important? A structured case presentation like this exemplifies how AI can assist clinicians in navigating complex diagnostic scenarios. It helps organize relevant data, identify patterns, and support decision-making. Finally, this case study shows how applying AI to symptoms like right lower quadrant pain can enhance our diagnostic accuracy. It demonstrates the potential of AI to analyze complex clinical data efficiently, ultimately improving patient outcomes while respecting data privacy and security. This process helps ensure that less common but still critical diagnoses are not overlooked in our clinical assessments. AI ranks these potential diagnoses based on the likelihood derived from the data we provide, which means it helps us prioritize what to consider first. Other important considerations include conditions like ileocecal Crohn's disease, GI lymphoma, and desmoid tumors, which can sometimes present with similar features. In our case, the top differentials are right-sided colon cancer, specifically adenocarcinoma, and appendiceal cancer. These are the most likely causes based on the clinical data. What AI does here is it provides a ranked list of differential diagnoses, which really expands our perspective on potential causes. It's a valuable tool because it helps us see possibilities we might not have initially considered, guiding us to be more thorough in our diagnostic process. So, in summary, this ranking system enhances our clinical reasoning by highlighting less obvious but important diagnoses, making our approach more comprehensive and evidence-based. When approaching diagnosis, it's important to tailor our tests to the patient's specific context. For example, we might consider TB or HIV testing depending on their risk factors and the setting we're working in. These targeted tests help us identify underlying infections that could be contributing to their condition. For procedures, a colonoscopy is invaluable because it allows us to directly visualize the colon and obtain tissue samples for pathology. This can be crucial in identifying conditions like cancer or inflammatory diseases. Imaging also plays a key role. We rely heavily on contrast-enhanced CT scans of the abdomen and pelvis as our primary diagnostic tool. They give us detailed images that help us understand the extent and nature of the pathology. In terms of laboratory work, a comprehensive panel is essential. We typically order a CBC to check for anemia or infection, a CMP to assess overall metabolic function, and tumor markers like CEA if we're considering cancer. Additionally, inflammatory markers such as CRP and ESR help us evaluate the presence of inflammation. Now, bringing it all together, AI can assist us by suggesting a prioritized workup plan. This plan emphasizes specific labs and imaging based on the patient's presentation, guiding us to rule in or rule out potential diagnoses efficiently. Overall, this AI-guided approach ensures we focus our resources on the most informative tests first, streamlining the diagnostic process and improving patient care. Now, let's talk about the importance of a multidisciplinary approach, especially in complex cases involving metastatic disease. When dealing with these difficult situations, it's crucial to bring together different specialties to ensure a thorough evaluation and the best possible treatment plan. This collaborative approach helps us make more informed decisions and tailor treatments to each patient's specific needs. Moving on, we have outcome data, which provides valuable insight into survival statistics and the risks of recurrence based on the disease stage. Understanding these figures helps us communicate prognosis effectively and plan follow-up strategies accordingly. Next, risk assessment is a key part of managing colon cancer. It involves evaluating potential complications, such as anastomotic leaks, which occur in about 2 to 6% of cases, and wound infections. Knowing these risks allows us to implement preventive measures and be prepared to address any issues promptly. Regarding management strategies, right hemicolectomy is typically performed with curative intent for colon cancer. In cases of metastatic disease, chemotherapy becomes an essential component of treatment. Finally, AI is increasingly playing a role in management by helping us stratify treatment options. It assists in predicting potential outcomes and complications, which supports more personalized and precise decision-making. Overall, integrating AI tools enhances our ability to tailor treatments, improve outcomes, and better manage risks in colon cancer care. AI isn't going to think for you, but it will think with you. That's a key distinction. Think of AI as a powerful tool that supports your decision-making, helping to reduce misdiagnoses and strengthen evidence-based choices. The secret to making the most of AI lies in 3 main things: having accurate data, asking precise questions, and understanding how the AI arrives at its conclusions. Remember, AI is there to think alongside you, not replace your judgment. It maintains the central role of the clinician, augmenting your thinking and providing broader insights. This collaboration enables more efficient patient care and better outcomes. Those who embrace AI early on will be able to get faster answers, gain deeper clinical insights, and ultimately outperform those who hesitate. So in the future of medicine, AI is not just a tool. It's your essential superpower for delivering top-tier care. If you enjoyed this video, please give it a thumbs up. It really helps us out and shows us what content you find valuable. Don't forget to subscribe to our channel for more AI medical insights so you never miss an update. And if you want to stay in the loop with the latest developments, follow us for future updates. Thanks so much for watching and engaging with our content. Your support means a lot and encourages us to keep sharing valuable information.